I'm Steve Sonneveld. I'm one of the TasIVF specialists. I've been working at TasIVF for at least 30 years now. The best part of my job is patients, people. People are fun, and they are. They're all different. I started work when I was 12 years of age, and I've done a huge number of different varied jobs. And therefore, I find people's employment and what they're doing is interesting. People are interesting, not just their medical history, just people. And they're fun. And I think that's the best way of approaching medicine is enjoy the people. The medical side is your job, but the people are the fun bit. I think the most important part of dealing with patients is that the patient feels comfortable with you. And if you look at my initial consultations with patients, my first 10 minutes is, who are you? What do you do? How many children have you got? And you develop some profile of the patient, the woman and the husband. And I think it gives you a better perspective of who you're dealing with. Sometimes it's also important, and certainly always important, to know what previous treatments they've had, what are their expectations. Sometimes can be helpful, but often it's just so they feel comfortable with you. I think my interest has always been general medical and general surgical. And so even if a patient says to me, I have Willy-Wop disease, if I've never heard it before, I'll look it up. And sometimes the best way to learn about a disease is ask the patient. If somebody's had that particular problem, they'll tell you a lot of information about that disease, and then you can go and confirm that in the textbooks. So I think even now, if I see somebody with some disease that I've never heard of, the first thing I do is write it down on a pad to ensure that I look it up out of hours. So I think a lot of us are like that. It's general medical stuff, not just infertility and IVF.